What are the types of primary lymphedema? Hereditary lymphedema, or primary lymphedema, is a genetic condition affecting the lymphatic system and is characterized by chronic swelling of certain parts of the body. One way to classify primary lymphedema is by the age of symptom onset, in which there are 3 types. Primary lymphedema can also be classified by the type of genetic abnormality and any associated symptoms. There are 3 forms of hereditary lymphedema, which are characterized by age of onset. Type 1 congenital, present at birth or up to 2 years of age. Type 2 precox, where swelling occurs from 2 to 35 years of age. And type 3 lymphedema tarda, whereby swelling occurs after 35 years of age. Congenital lymphedema is often associated with mutations in the FLT4 gene, while precox and tarda have been more recently associated with the FOXC2 gene. In most patients, primary lymphedema is inherited in an autosomal dominant manner. However, there is variability in symptoms and severity even within the same family. In 2010, researchers, by the name of Connell and colleagues, created a classification pathway founded on clinical phenotype. It was further updated in 2013. Phenotype is the medical term for the observable characteristics in an individual resulting from the expression of genes. The classification system that they developed was based not only on the age of onset of the lymphedema, but also the sites affected and the presence of associated features, such as aberrant eyelashes, varicose veins, prominent large caliber veins, vascular malformations, and limb overgrowth. The researchers also considered whether there was systemic lymphatic involvement, such as a history of hydrops fetalis in utero, which means the abnormal accumulation of fluid in 2 or more fetal compartments, including ascites, pleural effusion, pericardial effusion, and subcutaneous edema. The diagnosis of primary lymphedema relies on clinical presentation including symptoms, imaging of the structure and functionality of the lymphatics, and genetic analyses. To learn more, visit www.instituteoflymphedema.com.au.